Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and it's my privilege and honor to have you with us today. And today, my guest is Dr. Paul Patterson. Paul has been a physician for many years, and he is a specialist in hand and upper extremity. Paul, did I say that right?
You said it perfectly.
All right. Good. And he is a physician with Vero Orthopaedic here in Vero Beach, Florida. Great guy. Paul, thank you for being here with us today.
Thank you for having me. I appreciate it.
Certainly. Well, as you know, this is the Concierge Medical Marketing Podcast, and we like to talk about different topics that are relevant to physicians who either are in concierge medicine with their practice, or perhaps they're thinking of transitioning from traditional model to a concierge practice, or perhaps even people who are in med school who are thinking if they want to have a concierge practice when they finish their med school and residency and whatnot. So we have lots of different guests that we're going to have on this podcast, and we want to bring different points of view, different experience. Obviously, you've been a physician for a long time. Do me a favor, Paul. Please share with our audience kind of a quick background or snapshot on you and your schooling and your specialties. Give us some background, please.
So I'm born and raised from Buffalo, New York, the Miami of the North. I went to school at the University of Buffalo, and from there went on to graduate school at the University of Michigan. And then I actually worked as a sales rep for 3 years, selling research chemicals to biochemistry and molecular biology research laboratories. One of the most educational parts of my entire life, actually.
Sure.
Then I went back to school at the University of Buffalo for medicine, did my residency in orthopedics there. Then I did a fellowship at Harvard in hand and upper extremity surgery, came back to Buffalo to practice, was there for till 2 years ago. And then a combination of better weather, lower taxes, and vaccine mandates found me looking for a job in Florida, and I was blessed beyond belief to find Vero Beach, the jewel of the Treasure Coast.
It really is a beautiful town and an amazing area, isn't it?
It's incredible.
Yeah, the winters are a little bit more manageable than Buffalo. I'm just guessing.
Pretty much so. There really isn't a winter here.
Yeah, exactly. Well, last year it got down to like 60, 65 once or twice. So, you know.
My wife laughs at me because she'll actually see me wearing like a stocking cap and gloves when I'm taking the dog out. She just shakes her head like she can't believe I'm doing it, but I do sometimes.
Exactly. Yeah. We here in Vero Beach like to, I want to say rub it in to our northern friends, but it does happen sometimes. It was a couple of years ago when, upstate New York and other areas were literally just under feet and feet of snow and closing the football arenas and all that because of 10 feet of snow. And we're like, yeah, I swam in the pool today in the backyard. Sorry, guys.
Yeah. But I was one of those buried under 6 feet of snow.
Oh, yes. And we were buried under 6 feet of sand and sunshine.
Yeah, I know.
So, well, we're very glad you and your wife are here. We met at church several months ago, and it's really my pleasure to meet you and your sweet family.
Thank you.
Totally. Well, let's do this. Let's talk a little bit about concierge medicine. And concierge medicine and concierge practices, I found, means a little bit something different to everybody. There's different opinions and different ideas of what concierge medicine means. From your point of view, what does concierge medical practice mean to you?
It means incredible service, incredible access compared to what you're going to find in traditional medical models. And it's perhaps access that is one of the most important parts for patients. Unfortunately, the way medicine works, nowadays there's a lot of pressure for physician providers or mid-levels to see a certain number of patients to generate enough revenue to keep the lights on. And that often results in people being overworked, short-staffed, cranky. And as a result, if you're a patient trying to get into the practice and get calls answered or messages back, it can be pretty frustrating. What the concierge model did was say, okay, well, we're going to, in my opinion, and my understanding, is we're going to slow all this down. It costs a little extra money to do that, but we're going to slow it down to try and make sure that everybody gets the service that they really want. If you call into the office, you're going to get a response within an hour or so. You're not going to wait 1 or 2 or 3 days. That you're going to develop messaging systems in and out of the practice that will allow you to rapidly contact a provider and, again, receive some of that information back. And it's just that little extra care, especially when you don't feel well and you're struggling with something, that can be vitally important. But like I said, in today's traditional medical model, economically speaking, that sometimes in certain practices it can be pretty difficult to provide for the patient.
I had heard in a discussion with a different physician that who was with a big hospital system, that they were literally given 10 minutes per patient, and that's it. Excuse me. 10 minutes per patient, and that had to include not just seeing the patient, but also either entering the notes into the chart or using their little recording to dictate the message. Is that for real? Is it really 10 minutes per patient, and that's it? You got to get into the next room?
Not for me, but in especially hospital settings, yeah, that is the case. It is all productivity based, and that's the other problem with that is most doctors really did get in this to try and take care of people. Like, that really was a huge part of the reason that you do it. And when you realize in that kind of model that's a difficult, if not impossible, goal to attain, then you probably don't stay there very long. And as a result, that leads to high turnover rates. And when that happens, it happened to my father-in-law here recently. The cardiologist that he was seeing just wasn't there anymore. And while he was scheduled for an appointment to see him, I think later this month, now there's a new cardiologist, and he goes to the bottom of the list, and he's booked out like 3 months.
Oh, no.
And he has issues that need to be addressed, but there's no access. So again, that's one of the biggest problems, is just the access. And the traditional medical models, especially as employed by hospital physicians at this time, is really counter to trying to achieve any of the really high quality patient care metrics that we'd like to see achieved.
One of our clients is a cardiologist here in Vero Beach, Florida. And if you'd like, I can give you his name and information if you want to put your father-in-law in touch with him. He's actually been a cardiologist for over 20 years with a traditional model, and he's actually moving his practice into a hybrid, retaining his traditional payment clients or patients, as well as the concierge model for those who wish to have more direct access to him, his personal cell phone, texting, and really 24/7 access. So if you want, I'm happy to put you two together if you'd like to do that. Part of our podcast here is putting people together across our industry. And the more people that we talk to, the more connections that we can make so that everybody wins. All right?
Yeah, and I'd appreciate that. And I'd also appreciate talking to him about the hybrid model, because I think that's a fascinating possibility.
Exactly. And, the way he sees it is not all of his patients want to have that extra level of access, or if they're maybe they want it, but they're not willing to pay for it. And that's fine. He loves his patients and he wants to take care of them at the level that they're comfortable and that they desire the care. But if some are willing to spend, it's a couple $1,000s a year for the concierge membership, but through that, they're paying for the extra access and the ability literally to call them at 3 a.m. saying, my heart doesn't feel right. What should I do? Right. So I'm grateful that he's here in town and he's a great guy. I'm happy to put him in touch with you. Okay.
Yep. That'd be great.
Wonderful. Well, let me ask you this. I know that Vero Orthopaedic is a traditional model type of business. They have a beautiful new building the last year or two that you've built here in town. I'm personally a fan. I've had 2 back surgeries with Vero Orthopaedic for the herniated disc in my low back. Very, very grateful for the physicians and the staff who've taken care of me there. And so tell me, what do you see as far as Vero Orthopaedic? Is there interest there in perhaps adding concierge medicine to what they're already doing?
We've had very basic preliminary discussions between some of the administrative staff and some of the physicians, which, again, economics is constantly changing. There's a lot of pressure. The fee increases that we see as providers, and I mean nurses, therapists, and physician providers, doesn't come close to the fee increases that our insurance companies are getting. They are keeping most of that money for themselves.
Right.
And so we're constantly having to try and reinvent and consider new ways to maintain the revenue while costs are screaming up so that we can still provide the highest possible care we can to the patients. And so, as you mentioned, the interest in a hybrid model is very much something that we've talked about. The idea of providing another level of care, if you will, that concierge level of care. And I think one of the things that interests us most about that is it helps us. With that, there are some other people that we could take care of that might not be able to afford even some of the most basic levels of care. It's almost, I've always equated it to like a grocery store. There are certain parts of the grocery store where some of the products can make you a lot of money and some don't make you very much money. But when you meld it all together, it all works out well. And again, as we're coming into this and reimbursements are lagging behind costs, trying to find a way to help get that so we can keep everybody in the mix is a very exciting idea.
Wonderful. Well, I'm available if you and your leadership team at Vero Orthopaedic would ever like me to come in and join you on a meeting. It'd be my pleasure to be there. And if there's anything that I can add to the discussion that might help them to make a decision, I'm certainly grateful for the opportunity and happy to share if I could be of any service. So, Paul, as we talked about earlier, your position as a physician, as a surgeon, is in the traditional physician space, a traditional model. Have you ever considered becoming a concierge physician? And if so, what was your thought process behind that? What are you thinking about that?
I have not considered it because I'm not really aware of many opportunities in orthopedics to do that. Certainly, it would be something that I would consider. Again, I don't know if I would do as an exclusive model. I'd be more likely to do a hybrid type model, only because for myself, service has always been a huge part. I mean, when I was in Buffalo, I worked at the tertiary care hospital, responsible for taking care of all the indigents and things like that. And so I've always felt an obligation to take care of all those people. So I don't know that I could ever exclude them entirely from my practice or other people. I'm very inclusive. I would be more likely to consider concierge as an adjunct in the sort of ancillary and a hybrid model.
Right. Yeah, I've spoken to several physicians, and I think the hybrid model really sounds attractive to them for that exact reason. Sort of the idea of like, I want to serve as many people that really need me as possible. And in order to do that, it would be really great to have 20% or 30% of my practice as concierge paying the premium to have more direct access. But in doing so, can give you the opportunity to serve indigent population, pro bono cases or mission trips to Africa where you spend a week or two or a month doing surgeries and helping, kids with clubfoot or whatever. How does that kind of grab you?
Oh, very much so. Again, it's one of those things where we're trying to come up with solutions that allow us to keep up with the rising costs and the decreasing reimbursements. And so this is definitely part of that plan and strategy to make that go forward. That's
excellent. We talked a little bit earlier about the practice of Vero Orthopaedics, and that the leadership team has had some discussions about adding concierge as an area within that business as a way of helping more people, and in doing so being able to help more people, maybe those that can't afford the full rate services. Correct.
And like I said, at this point, at this level, they're really kind of like hallway conversations that we're having about different possibilities and things like that. We have not at this point really delved into it to any extent, but doesn't mean that we won't.
Sure. Sounds like an interesting opportunity, and you have such a great team there that I'm sure there'll be discussions over the next 6 to 12 months and see what happens.
Yes, sir.
In my research, I found a statistic that concierge medicine is currently a $6 billion industry in the United States, and it's forecasted to go to $13.5 billion by 2030. Literally 5 to 6 years from now. Where do you see concierge medicine as an industry going in 5 years, in 10 years?
I would expect that it's going to grow. A lot of it is going to depend on, what our economy does, what our federal government is doing with respect to Medicare. These are all going to be, and I don't think anybody's got a great handle on what's going to happen with that. If the trends that we see remain, and we get sort of this corporatization of medicine that's more concerned with throughput than quality, and as long as the economy doesn't crash, you're going to see concierge medicine grow. Right. Because people are going to reject, if they can afford to, they're going to reject that lesser level of care. And what's interesting is I think in many ways, when you talk about concierge care, I mean, I had my father-in-law was a primary care physician through the 1960s and the 1970s. I think you're just talking about the care that they got back in the 1960s and the 1970s.
Exactly.
I don't, and as again, all this is the result of that the pressures from decreased reimbursements and increased costs of doing business. It's unfortunate.
It really is. It's just sort of how insurance companies seem to be driving the train, and the physicians have to either accept it or do something else, right?
Exactly.
And we all understand that medicine is a business, and there's a tremendous amount of expenses in running a business, just the high levels of malpractice insurance premiums, and not just buildings and staff and equipment and all this. You go in for a surgery or a little procedure, and all the stuff that gets used and then thrown out is phenomenal, and all that stuff's expensive. And so I hear you when you look at this as a business, like something's got to change, because it can't keep going this way and survive, right?
No, and it's really the staff. Our staff costs are by far and away the largest costs, and again, just in these last few years, the rising cost of living, justifiably so, your staff need to be paid more. I mean, yes. They're all just trying to scratch out a living. And so that makes it harder. So that you have to try and figure out, as I said before, you have to use whatever means you have available to try and keep the revenue going, so you keep people employed and keep taking care of patients the way you want to take care of patients.
I love your heart. People work so hard and want to care for their families, and put their kids in school and let them do the field trips, and so many cases I've heard of literally in the last couple of weeks with kids going back to school right now is that parents literally struggling to buy school supplies for their children. You know, $20, $30, $50 worth of notebooks and pens and erasers and all that stuff. And that's a true struggle. Yep. I've noticed on social media. And, you know, a lot of these people are nurses, are, you know, home health care, home health aides, people who are literally struggling to survive when, you know, gallon of gas is, you know, well over $3 or $4 a gallon. And milk.
And many of them working 2 jobs.
A jug. It's an interesting time to be alive, and I don't want to get into politics on our show here, but it's an interesting time. I'll tell you that much.
It is that.
Let's change the direction here just a little bit. You are a specialist in upper extremity and the hand and wrist. You were telling me before we hopped on the recording here about a type of procedure that you do that's getting really great results. Can you share with the audience all about that, please?
Yeah, I'd love to. So carpal tunnel syndrome is a very common problem. And as it turns out, if you have carpal tunnel syndrome, a lot of people will lose like 2 to 3 hours of sleep at night. And the way we treated it when I was coming out of residency and fellowship, and until 2017 when I learned this new technique, it usually took months and months of ineffective treatments before we would finally operate on you. Lots of time away, you know, getting into doctor's offices, going for fancy expensive studies that hurt you, like the EMG nerve conduction study, and then finally you'd have a surgery. But in at least half of those cases, that's an open surgery. And that open surgery, where they make a bigger incision, takes a long time to recover from, because all those normal tissues have to get back to normal. And you're looking at somewhere between 3 and 6 months of significant alteration in the way you're going to use your hand.
And discomfort in the recovery.
Exactly. And that can impact your ability to make money, everything. Enjoy your recreational activities. So in 2017, I came across a technique called ultrasound-guided carpal tunnel release. And you do the procedure through about a 1/4-inch incision in the forearm, and it allows you to, there's a ligament that lays on top of a nerve that's squeezing the nerve. And by just releasing that or dividing that ligament, it'll separate about a 1/4 of an inch, and it takes pressure off the nerve, which allows blood flow to the nerve so that your symptoms get better. And that is very reliable. And our patients get better. Over 90% of our patients resume normal activities in about 2 to 4 days.
Wow.
Some mild soreness in the palm of the hand for a month for most. On about 5% or so will have more soreness that'll last up to 3 months. But by 3 months, almost everybody's fully recovered and back to doing what they want to do. And because I can so reliably make you better in a single visit, it means a couple things. It means, and because of some of the tricks we can do diagnostically, I can see you in a single visit, do your surgery, and not see you in a follow-up.
That's amazing.
So the first patient I ever did this procedure on, I explained to her why I was trying to do it. I was trying to find a way to be able to move some of these procedures into an office setting. To do some of the things just like you're saying, you don't need as many drapes. It doesn't cost as much money for anybody. It's much better in that way as well. And I told her what I was trying to do, and she goes, "Oh, you mean like going to the dentist?" And I was like, holy crap.
Exactly.
Like the first patient I see comes up with the best analogy for it. When you have a toothache, you don't go to the dentist and he looks at your mouth. He says, "Oh, you got a cavity. Here, try some aspirin and some Sensorcaine and come on back in a month and let me know how that works out for you."
Exactly.
And then you come back again. He's like, "Oh, let's get a special study. I'm going to send you somewhere, get a special study, bring you back, review the study, and after that say, why don't you come back in about 3 or 4 weeks and I'll do your filming." Right? There's a problem. He knows what the best fix is. The best fix is to fill the tooth. He knows that the fix that he's going to provide you is not something that's going to require a difficult recovery, so you don't need to follow up with him unless there's a problem.
Right.
And so right now, we're getting there in Vero Beach now. It's only been 2 years. It took me 5 years to get to this point in Buffalo. But in Buffalo, the average number of times I saw a patient with carpal tunnel that I did surgery on was 1.5 times. So half of the patients I did in a single visit, and half of the patients probably said, that sounds crazy to me. I want to meet this guy first before I do that. And so they'd come in and see me first, and then we would schedule their surgery.
Similar to a dentist who you visit, and they see that you've got decay. They do some X-rays. Yep, there's a cavity, and come back tomorrow. We'll drill the sucker out for you.
Right. And it's just it's been amazing. It's by far and away the most enjoyable thing I do, because most people aren't expecting that. I mean, in Buffalo, they were getting to the point, because it had become so well known, that a lot of people knew what to expect. But it is such a departure from what anybody in Florida that I know is doing on a regular basis. That it's fun, because you surprise patients. They're like, really? Because the procedure we do under a strict local. So that means a bunch of things. It means you can eat the morning of your surgery. It means you can drive yourself to and from if I'm only doing one side. And it only takes about, on average, once I sit down to start the procedure, somewhere between 3 and 5 minutes. And you won't feel any pain, at least in 99.9% of patients. On occasion, somebody will feel something, but I'm pretty good at numbing people up.
Yeah, the initial jab of getting the Novocaine, or let's see, what medicine do you use for your local?
Well, even that's much better, and that we stole from the dentists too.
Right.
So we use lidocaine, but all of those medicines are acidic in nature. There's an acid base to them. And so that whole idea of you're going to feel a pinch, i.e. the needle hitting into the skin, and then a burn. The burn is actually the acidic base, and your body reacts to it. But if you take and you put a little sodium bicarbonate in it, which is basic, now you neutralize the pH of the lidocaine. And so when I sit down to do an anesthetic on a patient, I tell them that the only thing you should feel the whole day that's painful is the first time the needle hits the skin, which isn't very bad. And then honestly, if I'm doing everything the way I'm supposed to, nothing else hurts the rest of the day.
Truly amazing. Love
it is. It's fun.
Any idea how many of these procedures you've now done?
Around 6,000.
Wow. Fantastic.
I've done a lot.
Amazing. Love it. So, Dr. Paul Patterson, this has been so wonderful speaking with you today. Thank you for taking your time, your effort, your sharing your knowledge and expertise. If someone listening in our audience would like to get in touch with you, if they have a question or want a consult or whatever it might be, how can they best get in touch with you?
They can call the office. The office phone number is 772-569-2330.
Excellent. This has been Steve Schwartz with the Concierge Medical Marketing Podcast. My guest, Dr. Paul Patterson. And Paul, thank you so much, and we'll see you all next time.
Thanks, Steve.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at 772-304-2420 or visit our website at conciergemd.marketing. We will see you next time.